My name is Nora Ambrose. I'm from Maywood, New Jersey, and I am due for surgery. My breast cancer journey started in 1996, where I was diagnosed with third stage 2 inflammatory cancer. I waited about a year before considering reconstruction, and I decided to do a TransFlap with Dr. Winters and Dr. Cohen. After that surgery, about a year later, I developed lymphedema. My arm did swell up, extending from the upper arm down to my hand. When I had cancer the second time, it wasn't as major. It was a small tumor, but I did choose to have a mastectomy, and I visited Dr. Cohen to see about reconstruction. And she suggested that once I finished everything, that I should consult Dr. Van to see about lymphedema because he was specializing in that area. And I did. I met with him. He ran some tests, and it was determined I did have lymphedema and suggested surgery with a robotic surgeon. My hopes for the surgery is to reduce the swelling of my left arm and to eliminate the infections.
My name is Robert Van. I am one of the plastic surgeons at Hackensack, and I specialize in microsurgery. We are going to be doing a robotic-assisted lymphovenous bypass for left upper extremity lymphedema. Right now, it's pretty tough for people, even experienced surgeons, to carry out these lymphatic surgeries because the vessels are small and it's just a difficult procedure. But with the robot, it's, more people can do the surgeries better, and when they're able to do it better, they're going to offer it a lot more places, and then people are going to be able to actually, get these procedures done and get their lymphedema taken care of. So Nora's case is kind of interesting because, she's had lymphedema for almost 30 years now. And when I first saw her, she hadn't been going to any therapist. She had tried it in the past, but, didn't really work out for her. She wasn't really wearing compression. My goal for her is ideally to, just take it one step further and make her life just a little bit better. She's had a ton of infections. She gets them fairly frequently. So I'm hoping by doing this bypass, we can help, improve it by, number one, getting out a bit of excess fluid, making the arm a bit smaller, a bit more manageable, and then decreasing the rate of infections.
My name is Rick Winters, and I'm the chair of plastic surgery here at Hackensack University Medical Center. We are very grateful to Nora, and we are very honored that she's excited about doing this. Not only can pedestrian microsurgery be done better with robotic technology, but we can push the limits of what we are technically capable of by doing smaller and smaller vessels with the use of the robot. Symani enhances our ability to do those operations better and push the envelope to do more and more challenging and difficult cases.
Today I'm feeling awesome, both physically and emotionally. I have not had any pain, very, very briefly for a couple of days. The outlook looks very promising, and emotionally I'm very happy that there is already some changes taking place, and we have to give it time, but we're getting there. The changes that I've seen mostly is that the arm itself is a lot softer, whereas there was areas that was very, very hard, but now it's soft. And this morning after my massage therapy, the therapist told me that the upper arm has reduced in size. Doing the robotic surgeon operation, I think it's the only way to go because there's no recovery involved. It's just 2 small incisions in the wrist, the upper wrist, and the next day you're able to do your normal routines.
So she's already seen her lymphedema therapist, which is perfect. And from her report, her arm's already decreasing in size, which is great. Her incisions are perfectly healed and there's no infection there, so I'm happy with the way that's going. And now we just checkup on her every couple of months. I mean, I can say that I will use the robot for every single lymphatic case because, once again, I think the control that you get with the needle, the fine little movements that you get when you're working with like these sub-millimeter vessels just makes the case a whole lot easier, and I think they get better surgery with it.
I would tell someone that's going through lymphedema to do research, that there are other options out there now. Technology has come a long way, and that there is hope, so don't give up.